Thank you, Terry. Good morning. Again, I want to thank Terry Allen and Dr. Heidi Gullett and all the good people at the Board of Health for their life-saving work. Each of you here get to hear a little bit about what they do when they come out each Friday. But if you knew all the other things that they're working on that they do, you'd be in awe, as I am. Today I have several announcements and updates. I'll start with the Small Business Stabilization Fund. Our small businesses need help to survive. Even as businesses are opening back up, some have been very severely damaged by this crisis. I, County Council, and our Department of Development, along with many crucial community partners, are working to make sure that we're able to get as many resources as possible to our local small businesses. We're helping as much as we can. For our first round of grants, we made awards to 200 businesses. I know we're making a difference because they told us. And I'm just going to share a couple of examples with you. One person said, "Wow, thank you so much for the wonderful news. This grant will help my small business make it through this pandemic, and that means the world to me." Another person, "I'm so grateful. This is so needed for me to keep my rental space. Thank you so much." And a third, "This is wonderful news, and we appreciate all the work you're doing to help small business owners in this area. This grant will really help us out." A week ago, we opened our second round of grants, and we again received tremendous response. More than 1,400 businesses have applied. I also want to make sure that everyone knows that there's still money available for small businesses through the federal Paycheck Protection Program. This is a forgivable loan that small businesses can use to pay employees. One of our key local small business assistant partners, the National Development Council, has already approved and funded over $2 million in PPP loans to 21 businesses in Cuyahoga County. If that funding had not been available, we could have lost 283 jobs. Small businesses can still apply to ndconline.org/PPP for PPP loans. And there's still about $2.5 million available for loans from our local partners as part of our stabilization program. Our Small Business Resource Center webpage and hotline are a good way to get more information and to get help applying. The hotline number is 216-452-9714, or you can go to cuyahogacounty.us/helpforbusiness. Supporting small businesses is a top priority for us, and we're working to do more. The COVID crisis has had a terrible impact on the economy and on local jobs. Since the start of the COVID-19 crisis in March, approximately 120,000 people in Cuyahoga County have filed for unemployment. People who never thought they'd be in this position filing for unemployment are finding themselves in just this position. Meanwhile, there are lots of companies out there looking to hire thousands of people in Cuyahoga County. The list of companies includes manufacturers, distributors, grocery stores, and many others. The challenge is to connect the people that need work with the companies who want to find them and hire them. In the old days, which is about 2 months ago now, job fairs in local facilities were a great way for employers and employees to make connections. Today, with the need to stay at home and with social distancing, job fairs in physical locations just won't work. But the good news is that we have a solution. Virtual job fairs. Cuyahoga County, the Mandel Supporting Foundation at the Jewish Federation of Cleveland, and Ohio Means Jobs, Cleveland and Cuyahoga, are partnering together to create virtual job fairs for companies in Cuyahoga County. companies that are hiring right now. Cuyahoga County and the Mandel Supporting Foundation have each contributed $150,000 to this initiative. In June, Ohio Means Jobs will host a virtual job fair a virtual job fair week that will provide a platform for employers to describe their hiring needs, products, services, career pathways, workplace culture, and how to apply. Ohio Means Jobs will also reach out to the job seekers to help them prepare their resumes and to get ready for an interview. And there's more to the program. For many of us, participating in a virtual job fair would be pretty easy. You'd go home, you'd turn on your computer, and log in. However, as I've said before, 25% of Cuyahoga County residents don't have internet access at home. And with public access like the library systems now closed, participating in a virtual job fair would be impossible. That's why, in addition to helping to establish the virtual job fair, we're also including a way to support workers that are unconnected. As part of our continuing effort to bridge the digital divide, we're partnering with PCs for People to provide 1,000 job seekers with computers, hotspots, and 3 months of internet access to assist during their job search. We want to make sure that everyone in Cuyahoga County, everyone has a chance at getting a good job. That's been an important goal of mine throughout my tenure as county executive. In addition to computers and internet access, the county will also provide access to 1,000 job seekers to an online job skills training program through the county's Skill Up initiative. Skill Up will help make sure that everyone's able to apply for jobs and is properly prepared for the work. We're continuing to recruit companies to participate in the virtual job fairs. If your company, if you're listening, you have a company that's hiring, we ask that you reach out to 216-777-8202 to participate. While June is the kickoff for the fair, it'll not be the last one. We're committed to continue to use technology to make sure that we can keep our economy humming while also maintaining proper social distancing for everyone's safety. This initiative would not have been possible without the generous support of the Mandel Supporting Foundation. I want to thank them for working with us to support this important initiative. I also want to thank Catherine Tkachuk, who's here, who helped lead this effort for the county. Oftentimes, we find that a crisis can spur innovation on a faster track than in normal times. Helping people get back to work in this new way is a great example of that. This crisis has people figuring out new ways to deliver services throughout almost every part of Cuyahoga County. Universal high-quality pre-kindergarten is one of the county's programs that's near and dear to my heart. So it's particularly painful to think of all the 3- and 4-year-old children who we were helping attend high-quality pre-kindergarten schools through scholarships, who are now missing out on important early learning. We're continuing to serve our young children virtually. One step we've taken to help these young children is to pull together a list of virtual learning resources for parents. You can find these resources at CuyahogaKids.com. In fact, many of our county invest in children's services for families with young children continue to operate virtually during this pandemic. Our early childhood mental health program is a great example. Support through this program is provided by licensed therapists who are specialists in working with young children and can help families manage the behavioral and emotional challenges that their child is experiencing. These services are for families with children under age 6 and are available free of charge. The program can help with ongoing issues that the child was experiencing before the pandemic, as well as emotions and behavior that may be affected in new ways and in ways parents may be unsure how to help. Through this program, an experienced professional will work with the family either by phone or video. This help, again, is free and it's confidential. If you're interested in getting this help, you can call 216-801-2778, and you can speak with an intake coordinator. Finally, while virtually all child care facilities have been closed as a result of the governor's emergency order, 5 Invest in Children universal pre-kindergarten sites have remained open as approved pandemic programs. The 5 UPK pandemic programs are Creative Kids, Fundamentals, Lil Achievers, Merrick House, and Sandy's Darlin' Munchkins. Great names. As pandemic programs, our UPK sites have been operating to serve the children of first responders and health and safety workers. This is crucial because we need our essential workers to be able to get out there and do the important work that they're doing to keep our county residents healthy and safe. So we salute and we support the first line workers who are keeping us safe. And we're doing what we can to assist so that they can continue doing their crucial jobs in the county. Thank you very much.
Thank you, Executive Budish. I was reminded when you were speaking about the county's mantra, Together We Thrive, and something actually, it hit me that you wrote in one of your addresses many years ago to the community. You said, "This is our county. We are diverse. We are rich, and yes, we are poor. We have magnificent pockets of natural beauty and unconscionable pockets of poverty in foreclosure devastated neighborhoods. Yet our fortunes are linked, whether we know our neighbors or not. Our lives are connected. We need each other to succeed. We need to use both our head and our hearts to show ourselves and our children what can be done when we dream big together." That stuck with me, and I think what you described today is a clear demonstration of that commitment, and we thank you for that. Next, I have the honor of introducing a great public health physician and partner, Dr. Tom Gilson. Dr. Gilson, we've had the pleasure of working with him in some very difficult situations, some heartbreaking situations around child fatality review, around poison death review in the overdose crisis we've dealt with that Dr. Gilson has played a major leadership role in. And so it was no surprise that as we began to deal with COVID-19, that Dr. Gilson was there to collaborate with public health in this response. And so Dr. Gilson is going to share a few comments and observations.
Thank you and good morning. I'd like to thank Executive Budish and Director Allen and Dr. Gullett for the opportunity to talk about a different perspective on the public health pandemic that we're facing with COVID-19 and offer you perspective on how the medical examiner's office has been trying to address this in conjunction with our other partners. Most of the deaths from the coronavirus actually do not come under the jurisdiction of the medical examiner's office, as they're natural diseases that frequently occur in people who are hospitalized. However, together with our partners in health, especially Director Allen and Dr. Gullett, we have been monitoring fatalities because one of the executive's overarching concerns is that we don't get caught off guard in surges and try to play catch up with them. Over the last 2 months, I can tell you that between the Board of Health and the Medical Examiner's Office, we have seen a slight, maybe 10% increase in the number of fatalities in Cuyahoga County over previous years and previous months. Right now, we can only speculate to what extent COVID-19 is responsible for that. I think in the midst of a global pandemic, it would be naive to think it has no role, but it's equally disingenuous to think all of this is related to COVID-19. The more immediate concern, because we can sort that question out later, is, are our healthcare facilities being overwhelmed, and are those people who have passed away able to be properly and respectfully taken care of? And I can say with certainty that those are both true, that we have an adequate amount of health care, and we also have not overwhelmed funeral directors and other folks who support the respectful disposition of people who pass away. That's something we do monitor very closely. Obviously, we all regret the lives lost. We continue to monitor how many folks are passing away, and we want to achieve those goals, that we don't overwhelm healthcare facilities and we don't overwhelm the funeral directors and the other folks in that part of the business who are responsible for respectfully taking care of people who have passed on. We'll continue to monitor them, but as I say, right now we're not at a crisis situation, and there are additional steps in place should we start to see that surge. In the event that there is a surge, I will continue to work with the health department to try to make sure that we achieve those goals I just mentioned. And obviously the executive and all of the people in this room will share that information with our media partners and with the public in general. I think one of the questions that I wanted to talk about today is the challenge of what really constitutes a person dying from coronavirus, COVID-19. I would like to say, as a preface to that there isn't any pressure on me as a certifier, or colleagues that I talk to at least, that there's a desire to over-report how many people have died to make the crisis look worse, or to under-report it to mitigate whatever agenda that might favor. I think I've heard people talk about these, but I have to say my experience, especially locally, is that those are outliers. That's not really a reality that I think has any basis in truth. We're not hiding deaths, we're not over-reporting deaths. The Centers for Disease Control and the National Centers for Health Statistics gave guidance what constitutes a coronavirus death. We follow those. They were pushed out to all healthcare practitioners in the county and in the state of Ohio. They are good, reasonable, and fair, and they're a good way to track the extent of the epidemic on mortality. So why is there ambiguity? A couple of reasons. There's people who die very obviously from coronavirus. It's a respiratory infection, and if someone has pneumonia and they're COVID-19 positive, well, that's a very obvious death related to coronavirus. Many of the people who have passed away have underlying illnesses. So if someone had COPD, for example, they already have a compromised respiratory function, and many people will die from COPD, but the coronavirus certainly is not a help in any of those situations. These are associated deaths. What becomes less clear, though, is not everyone who tests positive for coronavirus dies from coronavirus. So our testing, as I'm sure you've heard, as I've heard, has been a repeated stumbling block in a lot of ways to get an understanding of the extent of the disease. But it would be foolish, I think we would all agree, if somebody died in a car accident who had tested positive for COVID-19, and we would say that's a COVID-19 death. That's a car accident death. It's not a COVID-19 death at all. And we're not hiding the prevalence of the disease by saying, yes, they had COVID-19, but this wasn't a COVID death. I can't stress that enough because it concerns me, and I would say, there are issues about COVID that are probably going to take months, if not years, to fully answer. And some of those are just going to have to wait for. I would say, though, that with the executive and with the members of the Board of Health, that we're going to strive to answer as much as we can, as fast as we can. But I think that one of the great mistakes that happens, and we've seen it already in this pandemic, is misinformation is worse than no information. I want to give you honest, accurate information. Everybody in the county does. And I think that it would be fair to say some questions I can answer now, some questions are going to take longer to sort out. But as we do know, I want to give you the best information for the public so that we're not overreacting and not underreacting. It's a serious disease. Thousands of people in our country have died of COVID-19. I don't think that's an overestimate, and I don't think that's anything that we can treat lightly. But I also don't want to think that we have to go into an extreme response necessarily that isn't justified by science either. I thank you for the time, and thank you for the opportunity to talk to you this morning, and I'll hand it back to Terry. Thank you.
Thank you, Dr. Gilson, and as always, thank you for your partnership. So, as people are well aware, the governor provided information yesterday on the continued reopening of the state of Ohio. And as we look toward the coming weeks, we know that many more sectors will be active and coming back online. These include, on the 21st, indoor restaurants as well as campgrounds. The 22nd of May will be horse racing with no spectators. May 26th, adult and youth sports leagues, no or low contact sports. The Bureau of Motor Vehicles with some limited interactions. Fitness centers and gyms, public pools, those regulated by local health departments. Ohio will use more than $60 million in federal CARES Act funding to provide reopening grants to all Ohio's child care providers. These include family child care centers, and both publicly funded and private providers. The Health Policy Institute of Ohio released a data brief just yesterday on Ohio COVID-19 fatalities. Among the key findings are the following. COVID-19 deaths have already surpassed the number of motor vehicle deaths for all of 2018 and could soon overtake suicide. It's likely that COVID-19 will cause more deaths than many other leading causes of death in 2020. It's important to remember that we are still early on in this response. We are preparing for the possibility of a fall surge. And so there's many more months left in 2020, and the concern about COVID circulating with influenza in the fall, and we will return to that reminder in the coming weeks and months as we go forward. The important message from the Health Policy Institute of Ohio report is that we must remain vigilant. Even as we reopen Ohio, it's essential that we balance the health of our economy with the health of our people. There are 4 pillars of COVID-19 prevention that must remain in place and will be reinforcing in our role as the local health department at the Cuyahoga County Health Department. Social distancing, face coverings, hand washing, and regular cleaning and disinfection. These must be supported by responsible business practices that protect workers and patrons alike. Workers wearing masks, and we highly recommend that the public do so as well when they enter any of these establishments. Continuing remote work practices wherever possible, and supporting workers to stay home when they're sick. Remember, this is a novel virus that most people, until really the fall of last year, had never experienced. And so many of us still have not been exposed to this virus, and over time, these exposures will happen. And our job is to try and prevent them as much as possible and mitigate the effects of exposures. So go to coronavirus.ohio.gov for further information that gives guidelines by sector on how people can protect each other. As Greater Clevelanders, we're united in our responsibility to protect each other during this public health emergency, and that has not changed. The sacrifices we continue to make will be the measure of how many of us continue to contract COVID-19, and sadly, how many of us may die. We anticipate and are preparing for increases in cases and sadly more deaths even as we open up. We can't be fooled by the warmer weather. Please continue to do your part and be part of the solution in preventing cases and fatalities in your family, in your neighbors, and those that you love, and people that you don't even know. School graduations, we'll say a word about that. While the school year winds down across the state, local health departments have been advising and reviewing local graduation ceremony plans. Under the guidance of the state school closure order, we're working closely with administrators from across the county to be sure that public health and safety are foremost in everyone's plans. Single-family participation in staggered presentations of diplomas, social distancing, face coverings, drive-through approaches, and practical entry and exit procedures are all being instituted by schools to adapt to reduce risk during these important celebrations. We're proud to be working with the school systems that have embraced ingenuity and their creativity in helping kids and families celebrate at this important time. It's our intent to offer schools sound guidance in terms of planning and applying best practices to all the elements of any proposed ceremony. I'd like to thank our environmental public health staff. They've been involved in our call center from the beginning, very busy working with schools and families and the school community for their spirit of collaboration and public health prevention. We're very grateful for their patience and desire to do the best job that they can to protect the health and well-being of our students and families. As communities prepare to celebrate after graduations, we want to remind you to maintain appropriate social distance and group sizes. As the warmer weather gets moving here, that is something we're going to have to reinforce and be ambassadors of that public health message in our communities to protect each other. As for what will come this fall with the opening of the new school year, we have to wait further guidance from the state. So we're going to talk a little bit about community testing before I turn things over to Dr. Gullett. As we've spoken about for several weeks, community level testing is essential to helping better understand true impact of COVID-19 in Cuyahoga County. With the help of Executive Budish and Metro Health CEO Dr. Akram Boutros and his fantastic team there, we'll continue to do all that we can to provide that service. Last week, we reviewed the Ohio Department of Health list of testing priorities and told you that we're concentrating on what we call Priority 2 for the testing protocol. This group includes residents of long-term care and congregate living facilities, first responders, public health workers, critical infrastructure workers, people 65 and older, people with underlying health conditions, and people of racial and ethnic minority groups with underlying conditions. We're still focusing on this Priority 2 group as we go forward. We continue to support these groups as we have from the beginning of this response, and we'll continue to report all of our testing data in aggregate to track rates of COVID-19 in the community as reported by Dr. Gullett every Friday. So that is our intent, and we'll continue to provide that aggregate data and as much information as we can to you every week. I want to thank our data analysts and informatics staff that have been working hard and into the wee hours of the morning, often to analyze the data for these briefings, and their commitment is inspiring to me and is a demonstration of what true public service is about. With that, I'd like to turn things over to Dr. Gullett.
Good morning. I'm proud to, as a lifelong Cleveland sports fan, today I'm representing the Cavs. I've been trying to be equal opportunity, but my Cavs mask just arrived, so it's been the Indians and Browns until now. Thanks to all those Etsy shop owners out there who are working hard to make cloth masks and facial coverings for all of us who need them day in and day out. We appreciate you, and we appreciate your small business and how you're meeting the demand in this time. I'd also like to thank our media partners and our Cuyahoga County communications team. You have been steadfast partners in this. When we did this 3 times a week, you were always here bright and early. Sometimes before I even got here, I would see cars lined up from the media in the parking lot getting ready. And we just cannot thank you enough for your coverage of this, for your consistent messaging, making sure that we get everything we can to the community as clearly as possible. We know that that also represents those of you in the media who aren't physically here with us, but who are working hard to report day in and day out from your offices and sometimes from your homes. I'd also like to take a moment and thank Dr. Gilson and Hugh Shannon and their entire team. Dr. Gilson always responds to my request to teach the medical students. And that was our relationship before this, and in some public health work we've done together. But in the past few months, he and Hugh and their team are in communication with us and our team multiple times a day. And I can't tell you how much of a support that has been to us. So thank you for that, and thank you for being here today to help the community understand how we classify deaths. I'd also, finally, in my gratitude, like to thank all of the business owners and employees out there who have worked really hard to prepare your businesses for reopening. We know that this is very different than what all of us are used to, but we're very grateful for your commitment to protecting your customers and your staff as we get comfortable with the new normal. We really know that that's a sacrifice, and we're very thankful for that sacrifice. I also wanted to share that this week, as we've done more case interviews and more contact tracing, we have found that people who have returned to work have been engaging with their coworkers outside of work, and sometimes we realize that maybe not using all those practices we're talking about in social situations outside of work. That has led to new transmissions that then result in infections coming back into the workplace. So it's really important as we begin to open back up and more people are returning to the workplace, that you please wear your facial coverings, that you please do the most amazing hand washing of your life over and over and over again, that you please clean surfaces touched frequently, that you try to do remote work as much as possible, because we're seeing a lot more employer infections in workplace settings over the last week. And I suspect if we don't stay true to these great public health measures, that will be an issue for our community. The doctors in the back room here asked me to please share this message with you this morning. And so I give that to you based on our experience of the past few weeks. With that, I'm going to take a moment to pause as Ben finishes what I'm saying. And we'll be silent until the cameras can pivot over to the data slides. Thanks, Ben. All right, we have 4 thumbs up. Yeah, here, I got one earlier. So, as is customary, I'm going to go over the same kind of information each week. The first few pieces of information are the Cuyahoga County or CCBH jurisdiction. The lab confirmed cases this week are at 1,782. And probable cases at 472. The date of illness onset is February 28th to May 13th, and recovered cases are at 762. Our number of contacts is 3,572. And this comes from all of the contact tracing that we continue to do related to exposures from both lab confirmed and probable cases. The age ranges for our cases, and this is combined lab confirmed and probable, 1 week to 101 years of age, with a median age of 54 years. Nearly 55% of the cases are female and 45% male. We also have been closely tracking the percent of cases that identify as healthcare workers. This includes individuals who work in any healthcare setting, in any job in that facility. The percent of our cases that identify as healthcare workers is 21%. And the percent of our cases identifying with pre-existing conditions is 40%. And just to note, some of those cases identifying with pre-existing conditions are also healthcare workers. Here are the racial and ethnic breakdowns for our cases, and this week our team has also included the graphics. We did post those last week, but today are including them in our discussion. Race, 0.8% of cases identify as Asian, 36% is Black, 51% is white, 3% is other, and just under 10% we are still unknown. And in many of those cases, as I get a better understanding of the workflows with larger numbers of cases, those are individuals we haven't yet been able to talk with. For ethnicity, cases identify 3% as Hispanic, 75% as non-Hispanic, and 22% of our cases, we do not have those data yet. This slide is a graph explaining what I just went over in the previous slide with the numbers. We want to give you multiple ways to look at the information with regard to race and ethnicity. So you'll see the bar graph on the top is race and the bottom is ethnicity. These are combined cases for lab confirmed and probable. They are all together because we consider all of them cases. The next few slides break down race and ethnicity on a couple of outcomes, and we have given you these over the last few weeks. This one is hospitalizations. So out of our cases that we gave you earlier, 372 of those we have confirmed hospitalizations, and 51% of the number of our cases, of the hospitalized cases are identified as white, 41% is Black, 3% is other, 2% is Asian, and we have 4% of those cases that are hospitalized where we do not have race data yet. For ethnicity, 79% of the hospitalized cases identify as non-Hispanic, and 3% is Hispanic. In 17% of hospitalized cases, we're still obtaining the ethnicity data. The next slide identifies a subset of hospitalizations, meaning everybody included in this graph was also represented in the one before, because in order to be in the ICU, you're considered to be in the hospitalization data. So this typically represents more serious infections where people require a higher level of medical care because they are sicker from COVID-19. These represent lab-confirmed cases who were cared for in our local hospitals. 105 ICU admissions are currently included in these data, and 47% of those cases identify as white, 46% is Black, 5% is other, 2% is Asian, actually it's a little closer to 1%, and 2% unknown. 86% of those in the ICU identify as non-Hispanic, and a very small percent is Hispanic, with 13% of those remaining unknown yet. These are our fatality data, and as I point out every time I give these numbers, and as Dr. Gilson so eloquently pointed out earlier, These are families grieving in our community. Dr. Gilson and his team work really hard to make sure that grieving families have as much information about causes of death for the cases in which they're involved. And we all want to remember that we need to ensure those families are supported in their time of grieving, because it's different in being able to honor those who are deceased with COVID, given social distancing and other measures that are in place. So we're thinking of all of the families affected by these data and deaths from COVID. Our total deaths this morning are 129, with 126 lab-confirmed cases, 3 probable cases. The dates of death stretch from March 20th to May 12th. The age range for our cases who are deceased is 52 to 99, with a median age of 78 years, as compared to the median age for all cases in our jurisdiction, which is 54. 49% of our deaths are in women and 51% in men. Our race and ethnicity data are as follows. Less than 1% of our deaths are in people who have been identified as Asian, less than 1% in other, 27% identified as Black, and 72% is white. For ethnicity, 85% of our deaths are in those who are non-Hispanic. We do not have any deaths reported in individuals who are Hispanic, and for our deaths, 15% of our cases, we have an unknown ethnicity. This is a graphical representation of the race and ethnicity data that I just presented. These will be posted on our website shortly after the press conference. So as I move on, this is the customary slide to introduce our epi curve and our hospital capacity data. So this is our epi curve for all of the prior weeks plus last week, and you'll note it's very similar, just with 1 week added on. The red bars are both confirmed and probable cases, and they are listed on this graph by the date of illness onset. So that information comes from when we interview cases and we learn about their course of illness. The blue bars, I'm very pleased to point out, represent all of those cases that are cleared. They continue to accelerate the number of cleared cases, or those recovering from COVID-19 infection, weekly, and that is very exciting to us. And again, on the far right of this graph, you see that it looks as if it's trailing off, but that is simply that over the last few days, we don't have all of those case interview data we need in order to put when someone had an illness onset. So you'll see those days next week when we present this curve. This is our map for Cuyahoga County. This map is inclusive of all municipalities in Cuyahoga County, including the city of Cleveland. This includes both lab confirmed and probable cases. As a reminder, these zip codes represent the address reported by the case at the time of diagnosis. This does not represent where somebody had the infection or where somebody got the infection or was exposed. And finally, these are the hospital utilization data that I present every week. We here at the Board of Health are very interested in giving the overall picture of what is happening, given that we see data from all different hospitals, from people who stay in the community to live through their infection and never have to enter a hospital. And so we want to help the public understand the full scope of how this is affecting our community each week. Understanding that we're staying below that dotted line on the epi curve is really important, and we have still remained underneath that, which is very good news for our community and what Dr. Gilson spoke of earlier. Our medical surgical beds for adults are at 70% of our capacity. That is a decrease in utilization of 3% from last week. Medical surgical for pediatrics, so the number of regular hospital beds for children, is at 53% and is unchanged. Critical care adult beds are at 72% of use, and that is an increase of 3% from last week. And ventilators are at 32%, which is also an increase of 3% from last week. So these numbers have stayed relatively stable from week to week, which is really good news, in that our community has not had the number of COVID-19 infections that would overwhelm our hospitals and really force our healthcare providers to make really difficult decisions about resources. We're very grateful that has not happened here, and very grateful to our hospital partners for creating surge capacity and increasing the number of beds available to serve our community during this time. This is the final slide. There's one more slide about testing, which I showed last week. This one simply gives you basic information about the number of tests performed. Last week, you'll note that it was 10,588 tests, and this week we're up to 14,088. This is all of the testing that was done at 3 of the major labs in our community. This does not represent the private labs that are also working in our community to test. We don't have those data, but when we do have them, we will present them. But I feel it's still useful for the community to see that our testing is going up each week. The overall percent positive, which means the percent of cases tested who were positive compared with all of the tests done, is at 6.5% this week, and that's lower than last week, which I think represents that we're now testing people outside of the hospital a little bit more, outside of healthcare workers a little more, and so it represents a little bit wider net of those being tested. The range of percent positive for the labs who reported to us was 5.7 to 9.1. I just wanted people to understand that general percent of those positive tests this week. We continue to work to understand who is being tested and how the community testing strategy Terry spoke of can be used to increase testing to many parts of our community. And this last slide is simply for your information and will be posted on our website as it is on the ODH website. I reviewed it in detail last week, and Terry referenced it earlier. As a reminder, we are not at the point where we are testing everyone in the community, and we're also not at a point where we're testing people without symptoms unless they live in a congregate setting. Those are 6 or more people living together, or they work in one of those settings. As the capacity changes and the testing recommendations change, we will continue to update you in real time, and that will also be reflected in the overall testing strategy for our community. So at this point, before you turn the cameras, I'm going to introduce Ramona, and then we need to allow time for our interpreters to pivot back to the cameras.
I think we're ready. Good morning. I will keep my remarks brief today. Today is a heavy subject. Us discussing the fatalities in our communities from COVID-19. Dr. Gilson addressed one of the most prevalent myths that we hear, that we are attributing all deaths to COVID-19. Our team works diligently, as Dr. Gullett described, to identify and mitigate spread, especially in our vulnerable populations, to decrease sickness and death in our community. We want to fully understand the impact of COVID-19, but none of us here want to inflate the number of people who have died from this virus. Dr. Gullett speaks regularly of acknowledging the human loss behind the numbers we report weekly. Even amid a pandemic, grief is still grief. So today I want to acknowledge the work of our funeral home directors and funeral home workers, as well as our faith community. While social distancing has impacted our ability to gather and console each other in ways that bring comfort when we lose a loved one, these vital members of our community continue to support the loved ones of those who have died from COVID-19, as well as from any other cause. They've had to adapt their services to decrease the risk of spread at gatherings such as funerals, but still provide the comfort and care that is needed by grieving families. Next, I just want to discuss, with the reopening of many segments of our community, we should not take that as a sign that the risk of spread of COVID-19 has decreased. Our staff have been moving into different roles to staff up, to be ready for the consistent number of cases we've been experiencing, as well as if we see an increase in cases, and working 7 days a week to make sure that that happens. So I would like to remind our community, as said earlier, that many of the habits that we have adapted to, we should continue to still practice. So social distancing, good hand washing, and wearing facial coverings. And finally, as this pandemic continues, more conspiracy theories arise. It's not true just because someone said it on the internet. Please continue to seek information from valid and trusted sources of information such as the Cuyahoga County Board of Health, as well as our state health department and other local health departments. Thank you.
Thank you, Ramona. Any questions for us this morning? Vic?
Yeah, I know you've talked about this before. I got a two-part question, the first half for you, the second half for Dr. Gullett.
Okay.
I know you've talked about this before, but are you still, there's still some incidents of people not obeying the closure orders for businesses, et cetera? And even as the restaurants reopen, is there worries that maybe that there will be some circumvention of the rules that are set down?
Right, so the question is, from Vic, is about, are there any businesses that have not been complying with the orders from the governor relative to opening or whatever the procedures are? And then as restaurants or other businesses that open, is there concern about people sort of going around the rules? So I think our main message that we've learned to date is that most people far and away really want to try to comply. We may have differences on interpretation, which have been resolved by the Dispute Resolution Commission, because there are 88 counties, and occasionally people have different views on the intent of the stay-at-home order or the specific essential service guidelines. And so it's my sense that we've had a couple of court-related proceedings, but very few. I anticipate going forward with this expanded reopening that there'll be a lot of questions across a whole range of industries about how to best protect patrons, how to protect workers. And the health department is squarely across Ohio. Here locally, the Cleveland Department of Public Health and the Cuyahoga County Board of Health will be working with different businesses to help them understand the guidance which has been developed at the state level. Health commissioners from health departments across Ohio have been part of the work groups forming the guidance. And there's no perfect solution here. What we're doing is trying to reduce risk as much as possible during this reopening. There is no way to eliminate risk in society. We all recognize that. But I would anticipate going forward there will be a lot of questions, and we're poised in our call center to take those. We anticipate a lot of field visits to create clarification. And if people we're having difficulties with people that aren't complying, we'll certainly address those as they come. We expect the early stages of this work will be, as it was from the beginning, is to educate educate, inform, and guide our businesses so that we can protect each other. So I think you have a question for Dr.
Yeah,
Gullett.
the
So
second part
I'll-
of my question, and it kind of dovetails on it, but what are the concerns? You know, today, obviously, the restaurants will open for outdoor dining on the patio, and then when we talk next week, it'll be indoor dining. What are your concerns, if any, about restaurants and really kind of getting back to that normalcy if we're, I don't know if we flattened the curve enough, we're over the hump. Are there concerns from the county as far as maybe opening too quickly?
So Vic's question is, are there concerns about opening too quickly with regard to restaurants and other businesses that are phasing open? I think we here are ready to serve the community in responding to this pandemic at every step, and that includes the reopening process. We are here to do inspections and answer concerns or clarifications, as Terry mentioned. And on the medical side, we are here to identify any potential risk for transmission of the infection in any setting. And that includes newly reopened businesses, including restaurants and others. We've been doing that all along because essential businesses stayed open. And it is a full-time job making sure that we clearly identify risks for this infection to spread. That is the idea behind needing more testing. So as we open up, we will be able to encourage more testing now that we have some more tests available. But we also will be heavily focused on isolation, contact tracing, and quarantine, particularly as new businesses and new places in the community may be places where the infection is spreading. I would ask you to be very patient and kind to those who are working in these businesses because they too are trying to figure out how to protect their customers and each other, who coworkers, and we're all learning how to do this together. While we've been through other pandemics, this is a little different, and we're all learning how to wear masks in places we wouldn't normally do that. We're all learning how to appropriately talk to one another 6 feet away. We're learning how to provide services that we normally require human touch, where we can't do that anymore. So I would encourage everyone to just be thoughtful. These masks are to protect others from getting the infection from you, but also to protect you from getting the infection too, as are all of the other hand washing, cleaning, and other measures that business owners are putting in place.
Do you think will we get the right pace then, you think, or you're not, there's no uncomfortableness as far as where we are?
Yeah, our role here at the Board of Health is to work with our state officials and our local government, as we do very closely, to ensure the safety of the public at the pace in which this is moving. So our goal here, and we are committed to doing everything we can to minimize infection and the spread of infection. What I will say is that even though we have had lots of cases, there is still a very small percent of our population in this community who's been exposed. That means the vast majority of the rest of us are still at very high risk for this infection, and our immune systems have no idea how to respond to it. So we need to keep that in mind, because until there's a vaccine, we've got to prevent the spread of this. This is not something that you want to go out and expose yourself to just so you get immune. This is a very serious infection. It can be for some people. So it's really important to remember that we're going to be at this protecting each other for many months until we have a vaccine. So that's sort of the position that we operate in. We're all about doing everything we can to serve the community, minimize infections, and minimize loss of life.
So you mentioned you saw more employer infections just over the past week. And I know that while retail, some of the salons and restaurants, they're opening this week, so last week was manufacturing and some of those kind of businesses. Do you attribute it to those businesses reopening, or was that something you were seeing from some of the essential businesses that were open all along?
So the question is, are the infections that I mentioned that have occurred in businesses or employers related to recent reopenings, or are they from prior businesses that were open? I will say since the beginning of this in our community in March, there is no sector that is immune from this. We have seen cases in every sector of our community, and that includes different kinds of businesses. And it's not a reflection of people not trying to protect each other or their employees. It's simply a matter of how infectious this condition is, and the fact that many of us work in places where it's very hard to do our job by social distancing. So I want to be clear that we have had great working relationships with dozens of employers in the community, but we need everybody to do their part. I would say over the last week or two, the infections we're seeing are representative of exposures that took place 2 to 14 days prior. So those include some businesses that may have been open and others that are beginning to open. What I'm really concerned about is that people will really do everything at work to protect themselves and their customers and their coworkers, but then when they leave, let up on that a little bit, because you think, I've been at work with this person all day, we've been wearing masks, staying apart, I'm gonna jump in the car with them, we can really let our masks out, because you're just trying to relax, and that's where the spread happens. So those are the kind of stories that we have heard this past week of people saying, I didn't even think about that in the car with my coworker. You have something to add? No? Any other questions, Ms. Levy?
I want to follow you just for information, for background afterward on the record.
Okay, great. I just want to give a quick shout out to our fourth-year medical students who have been tireless in working with us here since the middle of March. They used their last few precious weeks of medical school, where they could have been packing their apartments, to be here actually 7 days a week, and they graduate on Sunday. And so I'll be cheering for you on Sunday from here. I'm sorry I won't be with you in Severance Hall, but we will be eternally grateful at this health department for the work you've done for us. And our staff is really working so hard, and we're grateful for their work too. But this is a group of people leaving us this weekend, and so we just wanted to say thank you. And finally, I've been talking about kindness and gratitude all along. And this is going to be a new week for us in this community as we figure out how to work together. So I would really like to remind everyone to please be kind. You can do that through lots of socially distanced ways. But the tensions are high, the anxiety is high, the stress is high for every one of us whose lives are changed. No one is unchanged from this pandemic. But I'd like to remind you to please be kind to one another and to support each other in new and different ways. It makes all the difference in all of us getting through this together. With that, I'll turn it back over to Terry for the final words.
Thank you, Dr. Gullett. I'll just say in closing that I wanted to take a moment to thank my twin boys who had finished their first year of college, and so I've been working remotely for school, and they have a birthday coming up this week on the 19th. And they have, I've been proud of them in really following the social distancing and guidance. It's tough for kids to do that, teens. One of them, I shaved his head, the other one has a mop on his head underneath a baseball hat. And we all know this who have teens. But they've done a good job, and we know kids feel invincible. We've talked about that. And we're about to enter the summer. And so kids, as we're hearing, there are cases among kids that some have been severe, but many of them have been mild. But often we need to remind kids it isn't about them as much as it is about at-risk people like their parents or their grandparents or their neighbors. And so I thank them both, David and Neil, for doing a great job on their social distancing, which is tough, and trying to lead with friends. And I ask all of you, family members, parents, to remind your kids to do the same. And remember, it's every step that they take to try and limit exposures will limit unintended exposures for those most at risk. So we'd like to thank you. Have a great weekend. Enjoy the sun. And follow the guidance that's out there because this isn't over, folks. We've got a ways to go yet. Thank you.